Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about Warthin's tumor, which is the second most common benign salivary gland tumor that we have. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So, what is Warthin's tumor? So, Warthin's tumor is this benign salivary gland tumor which is composed of two important elements. First element is that it is composed of oncocytic epithelial cells which line the ductal, papillary, and cystic structures. And the second component is that this lies in a lymphoid stroma. So these two specific characteristics define Warthin's tumor. What are oncocytes? And these oncocytes are actually cells which are very high in mitochondrial component, because of which it gets a very granular and dark pink appearance. These oncocytic cells are the main lining cells in case of Warthin's tumor, and it is surrounded by a lymphoid stroma, and sometimes which also shows germinal centers. So that's what Warthin's tumor is. So there are some other names that was given to Warthin's tumor, but it is no longer used. And these are two names, two synonyms over here, which is one is papillary cyst adenoma lymphomatosum and second is adenolymphoma. Now let's try to understand where this name comes from. This name will actually come from all the histology that you'll be seeing in Warthin's tumor. Now let's look at the image over here on the right side. So basically, Warthin's tumor is this adenoma formation which has a lot of cystic spaces. So you can see these are all cystic spaces that we are seeing, and these cystic spaces have papillary projections into them. You can see that these are the papillary projections into these cystic spaces occurring over here. And secondly, all these purple areas that you are seeing, these purple areas are the lymphoid matrix, and some of them have germinal centers. So, what are we seeing? So, papillary, let's look at the name. So, it is saying papillary. We have already seen papillary projections over here. Then it is saying cyst adenoma. So basically, there's cystic spaces within the adenoma. And lymphomatosum because it is surrounded by the lymphoid matrix, which shows germinal centers. That is the reason behind this name. So that is the basic histology. I'll discuss a little bit more in details in some time. So, as I mentioned, Warthin's tumor is the second most common benign salivary gland tumor. So, that brings us to the question, what is the most common benign salivary gland tumor? We have already discussed this, and this is pleomorphic adenoma. I have made a separate video on pleomorphic adenoma. You can check for details out in that video. So, Warthin's tumor, another peculiarity to remember over here is that it arises exclusively from the parotid gland. So, this is a very common MCQ question. So, I'll explain the reason behind it also when we are discussing the histogenesis of Warthin's tumor. So, the site of Warthin's tumor is the parotid gland, and more specifically, it is in the lower pole of the parotid gland, posterior to the angle of the mandible. So if you see in this image over here, this is our parotid gland, and in the lower pole is where the Warthin's tumor comes. So Warthin's tumor constitutes about 5 to 10% of parotid tumors. The age group that this is common in, this is more in the elderly age group in the 6th to 7th decade. A very important MCQ question again is that this is one of those salivary gland tumor, the only salivary gland tumor which has a male preponderance. All other salivary gland tumors have been seen to be more common in females. So this is also an MCQ question. Most of the tumors are unifocal, but sometimes 10% of cases we see it to be multifocal, and 10% cases can also be bilateral. Next, talking about the risk factors associated with it, another MCQ question coming in, which is the only salivary gland tumor which has been associated very strongly with cigarette smoking, about 8 times increased risk in cigarette smokers than the non smokers. Second, the virus to be found to be associated with this also is Epstein-Barr virus, but this has not been proven completely. this could be an MCQ question in case you get options to choose one specific virus. Epstein-Barr virus would be the answer. And another risk factor is exposure to radiation in atomic bomb survivors. So that's a bit about some MCQ questions on Warthin's tumor and some basic information that you need to know. Now let's go into discussing what is the histogenesis or what is the theory behind formation of the Warthin's tumor. So the most accepted theory right now is known as the Heterotopia theory. This theory is stating that during the time of embryo formation, some salivary epithelial inclusion gets trapped within the intra or the periparotid lymph nodes. These inclusions, which are trapped within the lymph node, now start to proliferate later and they end up forming the oncocytic epithelial component that we just described. And this oncocytic epithelial component later gets surrounded we discussed that this is happening within the lymph node. So this lymphoid tissue over here is actually the tissue that is forming the lymphoid stromal component of the Warthin's tumor. This theory is accepted because we are seeing that this explains why Warthin's tumor occurs only in the parotid gland and not in other submandibular or the sublingual glands. That is because parotid is the only gland with an intraparotid lymph node, with basically a lymph node inside of it. That explains why it is exclusively occurring only in the parotid. So that is the most commonly accepted theory. There's another immunological theory which suggests that maybe this is a immunological response. So the lymphoid stroma that we are seeing in the Warthin's tumor could be a reactive immune response to the oncocytic epithelium that develops. So this is about histogenesis of Warthin's tumor. Now let's look into the histology of this tumor. So first let's look at the gross or the macroscopy. So on gross examination, the tumor will be a smooth, soft mass with a well-defined capsule. Let's look at the image over here. This is Warthin's tumor. This portion is the tumor, and you can see this is the normal salivary gland tissue. We can see distinctly that there is a well-formed capsule around it. And cut section of this tumor will show some cystic spaces which is filled with brown viscous fluid. And sometimes this fluid has the consistency to be looking like machine or motor oil appearance. So that is about the gross appearance of Warthin's tumor. Next, looking at the microscopic appearance. So I have briefly mentioned to you what it is. So the first part is we find a lot of cystic spaces which are lined by these ductal epithelial cells. So if you look in the image over here, these are these cystic spaces. This is over here, this is the cystic space, which is lined by all of these epithelium. And these cystic spaces, they also have some secretions filled. You can see this is the secretion over here. These secretions usually consist of proteinaceous material and cellular debris. Now, if we look deeper into the epithelial lining over here, we can see that this is our epithelial lining, what it is marked. You can see over here. This epithelial lining, it is actually forming papillary projections. You can see multiple papillary projections everywhere in this image. So these papillary projection is the reason why it has been named as papillary lymph adenoma. So that explains the papillary folds. Now, if we look deeper into the epithelial lining, we discussed that epithelial lining is by oncocytes. Oncocytes are these cells which are rich in mitochondria, because of which it has a very granular and deep pink appearance. Now, this epithelial lining has actually two layers within it. You can see first, if you look at the image over here, these areas that you're seeing, this is the double-layered, the bi-layered oncocytic epithelium. Now, if we had to break down this epithelium, the two layers are, let's look at the third image over here. So the inner lining, this is the inner lining which is towards the cystic space. It is lined by tall columnar cells, and you can see that there is a palisading nuclei appearance which are centrally placed. So that is our inner lining. and the outer lining is the cuboidal cells, which look a little basaloid. So these are the two epithelial linings forming the oncocyte in the cystic spaces. And these cystic spaces, they are in itself surrounded by lymphoid stroma. That is the second important characteristic over here. So if you see these purple like structures over here, these are the lymphoid stroma. This is the lymphoid stroma that we are seeing, and these lymphoid stroma sometimes they have germinal centers. So this is about the histology of Warthin's tumor. Two main things is we'll have cystic spaces which are lined by oncocytic cells, and these oncocytic cells are two layered. There are two layer over here. Inner lining has the tall columnar cells and outer lining has the cuboidal cells. And this epithelium is surrounded by lymphoid stroma which have germinal centers. Now, looking at the clinical features of this disease. So, that this presents as a well defined, very slowly glowing, painless mass in the lower pole of the parotid. Mass is usually cystic and fluctuant, and this mass usually does not attain a huge size. Maximum would be a 3 to 4 centimeter diameter. There is usually no other feature seen. Malignant transformation is very rare in these cases. Sometimes you can see otalgia and tinnitus, and facial nerve palsy is also very rare. Next, how will we investigate the case? So, as usual, like any other benign salivary gland tumor, we'll perform an ultrasound, which is our first line imaging. This will help in differentiating the solid versus cystic, intra versus extraglandular lesion. This is also useful for guiding FNSC. And when you perform FNSC, which is the most commonly used tool, this will help you in differentiating benign and malignant lesion. Last of all, investigation specific to Warthin's tumor is scintigraphy using technetium 99M per technate. This is useful here because we know that Warthin's tumor has oncocytes, and oncocytes are very rich in mitochondria. There is a high mitochondrial activity. Because of this high mitochondrial activity, it forms hot spots when you use technetium 99M per technate. That is one of the clear-cut investigation to find out what is tumor. Lastly, how will we treat the case? Treatment is very simple. Surgical excision is the only answer over here. There is no other treatment choice. We usually perform a partial superficial parotidectomy where we remove the superficial lobe along with the tumor, and we try to preserve the facial nerve, identify it, and preserve it during the surgery. And lastly, recurrences are very rare in this case. Malignant transformation is also very rare. So that's all about Warthin's tumor. If you have any questions on this, please note them down in the comment section and I'll get back to you. Thank you.